Good afternoon. We are now going to begin our community luncheon panel discussion. I want to remind everyone that this is in fact being sponsored by Sun Children. Today you're going to hear from healthcare professionals talking about the status of Black and brown healthcare in their respective disciplines. Before I go any further, my name is Kenneth Boudreaux. I'm honored to serve as your co-host, and I'm even more honored to serve with the living legend herself, a very, very dear friend, St. Landry Parish favorite, someone who made the switch, and so can you, Miss Marcelle Fontaine.
Thank you very much, Mr. Boozer, and thank you to all of you who have made the switch. I am Marcelle Fontaine with News 15, and it is my pleasure to be here with you this afternoon for such an important discussion about health in our community, a very broad topic, and we had to find a way to narrow that down to some key components of healthcare for people who look like us.
Yes, and before we get into those components, I just want to tell you a little bit about what is happening here this weekend and what has been going on over the last 7 months in just a couple of lines. You are here with Lead Louisiana. Lead Louisiana is a leadership and training development organization who focuses on the training of individuals, but the training takes place from a Black and brown perspective. You have heard of programs called Leadership Louisiana. You have heard about things like Leadership Lafayette. Two really, really great programs, but this particular program focuses on making sure that those who come through these particular cohorts have a focus on keeping Black and brown perspectives at the forefront. So we invite you to hit the QR codes that are illustrated throughout the room, ask questions, go to the website. Actually, registration for the next cohort has actually begun, and we invite you to participate. Also, just a few other announcements very quickly. On Monday at 6 o'clock p.m., this coming Monday, April the 14th at 6 o'clock p.m. at the Martin Luther King Recreational Facility here in Lafayette, Congressman Cleo Fields will be having a town hall. He is traveling his district doing town hall meetings, and some of which you're going to hear about today are things that you could possibly address there, because what we hope to do here is focus a lot on policy. We do well on provisions and services, which will be a part of this, but of course the policy piece is one that's going to be significant and important going forward, as if healthcare gets rolled back, undone, destroyed, then services follow. Also, on tomorrow in the same building, for the graduation, you are invited. It's free of charge. If you would like to attend, the guest speaker is none other than General Honorary, the retired colonel. Of course, many of you all knew him. He led the efforts and the recovery of New Orleans in particular after Hurricane Katrina. Everybody noticed the famous line, "Put those damn guns down," as individuals of our military, in an attempt to keep things safe and protected, was acting in a manner that he did not approve of to individuals who had been victimized. So on tomorrow, the only thing we need you to do, the table that you pass when you enter, we do need you to register so they can be prepared for those who will be here. So if you want to come and hear General Honorary on tomorrow, you are invited and welcome to do so. As we honor, which I would now like to recognize, and I apologize for doing this to your team, but would the cohorts of Class 3 please stand up where you are, just so people can know. This is the class of Lead Louisiana, who's in their last weekend of activities and events and training, and hopefully, after graduation, they're going to be active participants in the Alumni Association of individuals doing great work throughout the state. Thank you all very much. All right. So again, with that said, as Marcelle indicated, we have an amazing panel who's going to share information with you that is of great value. And we certainly just wanted to say that these presentations, these particular topics, are only a few of hundreds of healthcare issues that we could talk about today, okay? And as you see the introductions of those of our panelists, you'll see on those topics, but we do not want you to feel that we are confined to just these issues here in Louisiana. But this is going to be the discussion for today, as we could have spoken about so many different issues, so many different things in the area of healthcare and its impact on Black and brown people. But today we hear from these organizations.
We know that a lot of these topics will carry over from one to the other, and also touch on other aspects of healthcare as well. But our professionals here, our experts this morning, are going to talk about the things that they do, what they see in their work day in and day out. So let's get to it. We're gonna introduce them and allow them to introduce themselves. First and foremost, Dr. LaShonda. Dr. LaShonda. I know her from Opelousas. We went to high school together, and then she got married and her last name changed. So, Dr. Green.
It's a pleasure for me to be here with you guys today. Like Marcel said, I'm Dr. LaShonda Green, pharmacist and owner of Medicine Men, which is in the heart of the North Side on Willow Street. I've been a pharmacist for 23 years now. So I don't believe it's been that long. But there's definitely an abundance of issues when it comes to medication and pharmacy that we'd love to kind of touch the surface on today. Get any questions you may have answered, and see if we can kind of get the ball rolling in a positive direction for people that look like us.
Absolutely, and just shameless plug, she's my pharmacist. That's where I get my medicine from. Joining Dr. Green, we are so happy to have also with us the very lovely Miss Angele Bradford, PhD.
All right, hi. So I got my PhD from Tulane Med last spring, and I earned that in physiology and medicine. My background is in cardiovascular physiology, type 2 diabetes, and cardiovascular disease. But I've been with Louisiana Families for Vaccines since they started, I guess, Kate, like 2021, 2022, whenever we were just throwing down at the Capitol over all the crazy bills that were being proposed during COVID. And after I got my degree at Tulane Med last year, and something else that I could wax poetic about, but I know we don't have much time for, but happy to talk offline about. So my cousin ended up getting diagnosed with cancer, so for the past year he's been undergoing chemotherapy, radiation, treatment for a brain tumor. And so I've been able to see like the Medicaid and cancer side of the patient experience in Louisiana, and that's been a total education as well. And so super glad to be here, super humbled by the last year and the experience both as a medical scientist and then as a caregiver and then for a husband as a patient. So yeah.
Mr. Bridger, I might just add, you are a lucky man. This is one dynamic panel of incredible women and intelligence and beauty and all those things. I just thought I'd point that out real quickly. Next up, we hear from Ms. Christy Gojo.
Hi, thank you for having me. I'm Christy Gojo, a community educator for LOPA, which stands for Louisiana Organ Procurement Agency. I'm also a multi-ethnic specialist with LOPA and a kidney health coach. Outside of that being my profession, I'm also a living kidney donor. My husband received a kidney when we were just friends from me. Before we even got married, before we were dating or any of that, I was just hoping he could feel better.
To a whole other level.
Right, just wanted him to feel better. But eventually we started dating, got married, and had 3 kids together. I already had 1, so he had a bonus son, so we had 4 kids. But I'm now a widow. He passed in 2023. And so, like my PhD partner over here, I have multiple sides or perspectives of healthcare, right? It is being a living donor. It is being on the side of seeing where they come from, dialysis, and being able to live a life that you didn't think that you would have. And then also going back on dialysis, the importance of medication and taking the anti-rejection medications, and then understanding advocacy. A lot of times we have this conversation with the community about organ health and organ donation, but when it is your lifestyle, when it is personal to you, the conversation looks different. So I appreciate the opportunity to be able to talk to you all today.
That's what I'm talking about. Anybody? Yeah, she meant it. She meant it. You understand? That just took relationships to a whole other level. Before he was married. Before he was married. I must say, just for the record, I just want everybody to know my entire life, personally and professionally, I have been surrounded by strong, very intelligent, beautiful black women, and it doesn't change us on this stage today. Thank you very much. And our last panelist is none other than Cheryl McGee Hills.
Hello, everyone. I'm really excited about being here. Is that me? I don't know. Okay, that was me. That was me.
Your own special introduction.
Oh my God. I call on him and praise him from New Orleans till I found over around the corner here. But I know whatever God wants me to be, it's not a straight shot the way I think it should be. He'll take you all around to where you're supposed to be. That was in my heart. I had to say that. I'm with the Louisiana Organ Procurement Agency as well. This is my 25th year at LOPA. I thought it was going to be my last year. I thought of retirement at 16. Everybody should be retired. But you know, that's me. That ain't God. I came on board with LOPA as a donor, recipient donor family. My brother Lionel Brazil had aneurysm. And on Friday, we said, let's pray. Sunday morning, he was declared brain dead. We were approached by local Louisiana Organ Procurement Agency for consent of organ donation. Well, I forgot. My husband behind me had been on dialysis for 5 years. I forgot that. But my dad said, you're number 1 of 9. You make that decision. What? So we did. We made a decision. Direct donation. If one of those kidneys are a match, can Robert McGee have one? After testing, it was a match. My husband received one of my brother's kidneys, a gentleman in Slidell, a lady in Mississippi, another gentleman in Stone Mountain, Georgia, and a lady in Jacksonville, Florida, received my brother's organs. Within 6 months, we became volunteers with LOPA, and that lasted 3.5, close to 4 years. Robert went into rejection, and he passed away. But one thing he said, whatever is good, please donate it. So we donated the corneas, and that restored 2 sites to 2 people. January 2001. After that, I said, I'm not doing that no more. People die. Again, there we go. He don't let you sleep. That was October. By October 2001, I became a full-time employee hired by the Legacy Foundation and LOPA to discuss organ donation in the African American community because we didn't donate. And we still don't because we fear sometimes death, sometimes, or if I put a hold on my driver's license, they're going to kill me behind, let's say, Evangeline and Charity Hospital, and they're going to take my organs. Great movie, but it doesn't happen that way. So today, Christy and I are going to talk about why there's so many black people on the wait list. 2,000 people, and 68 to 70% of black men, women, and children. Okay, that might be again, but that's okay because I'm here to discuss it. For God not to sit me down and let me go to Hawaii somewhere, that means it's something else He wants me to discuss with black people. Don't fear death. That's God's issue. What we need to figure out, and our slogan is making life happen. We're talking about life. And I thank you for listening or passing on because I talk a lot.
That's definitely what we do.
Well, and we thank you for that. So as you can see, we got an amazing panel. And we're going to move around a little bit as far as this discussion. We're going to give them each an opportunity to speak into their space. And at the same time, we're going to be conscious of time. We know that you are here on your lunch break and that you chose to have lunch with us. And we thank you and we are grateful. I'm going to go first and I'm going to talk to my pharmacist just for a second. Because in this area of healthcare, prescription drugs have been utilized in very good ways often, and sometimes they're abused. And things like the sharing of drugs, or I need this particular pill, I'm out, can I borrow one of yours? Just so many things, there's so many miracle drugs, could put muscle on, could take fat off. making me feel like 20 again. I mean, there's all types of stuff out there. What is it that you think, or in your industry, what do we need to know in the African American community? Prescription drugs, the good, the bad, and the ugly.
I think the first thing for us is that we don't ask enough questions. We will go to the doctor, let them write a prescription, have no idea why I'm taking the medicine. So I think the first thing is that we need to be advocates for ourselves to know, wait, why am I taking this? What is this? What does it do to the body? What can I not take with it? What can I take with it? Can I eat? Can I not eat? So I think first we're just not educated enough. I have patients that'll even come and I'm like, okay, this medication is for your diabetes. I have diabetes. And it's kind of like, let's pump the brakes, because before we left the doctor's office, there are some questions that we just need to ask. Even if it's our elderly family members, if someone needs to go with them to help them with asking questions. I think that that's the first thing. We don't ask enough questions, so we are completely oblivious to our health care, which unfortunately in our community, diabetes runs rapid, hypertension runs rapid, high cholesterol, well in our area, runs rapid, and then we end up with organ failure. So before we get to that level, there are things that we need to do and know to educate ourselves to be in better health before we even get to a point where now organ donation is where we are. Because it's not an easy topic, not an easy thing at all. It's very difficult. My mom actually just passed away this past February, and she was on dialysis. And we wanted to do organs and all that. Because of her health condition, she was like so extremely bad off when it came to health that it just wasn't, I guess, a justification for her to be on the list in comparison to maybe a healthier 20-year-old that may have needed a kidney as well. So for me, it definitely is a big issue, and it's important for us to know and educate our family members and ourselves on health care, proper health care, what we should be eating, how we should be taking medication, and number one, why am I even taking the medication?
Piggybacking off of what you just said about educating ourselves, and I think it's something of note. We know often when we go into a doctor's office, you've waited an hour and a half to be seen, and then you get in there and you're in there for 5 minutes with this prescription that you're walking out with. How do we combat that and say, take a moment, I need to ask questions, and then educate ourselves on the back end? Because it can be intimidating if you don't know. You're hearing these words that you've never heard before. You're getting this diagnosis and you don't know what it means. And oftentimes we leave with that intimidation factor of, I just didn't ask. Or I didn't know to ask in some cases.
Or didn't know the questions to ask. And I always say, just keep it simple. Always ask, if you hear a word, however big, however small, that you don't understand, stop and ask, what does that mean? Can you break it down to something simple that I may understand? And don't be afraid to do that, because it is your doctor, your nurse practitioner, or whoever that healthcare provider is. It's our obligation to make sure that once you leave from having a conversation with me, that you're leaving with at least a general understanding of what it is that we talked about in our session.
Thank you very much. Dr. Bradford, I'd like to talk to you. One of your specialties is vaccines. Vaccines are under attack, you could say, both nationally and on a state level here in Louisiana. Talking to this room, what do you say for us? What do we need to know? How do we advocate for ourselves? Can we walk in and just ask, I know this vaccine exists, can I get it? Can I get it for my child, my loved one? How do we bridge that gap between something that's not even being talked about much anymore?
Yeah, it's certainly a tough time, especially because it's not even just like federal and they're like very anti-vax energy and policies, but also Louisiana Department of Health now has their regulations around how they talk about vaccines or can't talk about vaccines and can't promote them. while we're also seeing, like a measles outbreak in the U.S. in modern times in Texas, which is wild, and we've lost 2 kids because of it. So what I will say is, I know there are barriers because it's really simple to say like, oh, go get your kids vaccinated, but I know there's ages, me and Kate, we talk about all the time, like under 5 is a lot more difficult sometimes to get the COVID vax. Certain pediatricians don't carry it. It's a very complicated network in Louisiana. I totally understand that. And so my advice, first things first, is you do your research on the internet. CVS, Walgreens, all of those, they have a pretty good website of what's available right now. Unfortunately, in the beginning, back when there was, Johnson & Johnson, which I think is technically Janssen, and then Moderna, Pfizer, all the different choices, those aren't as available as before. Like, most places are either Moderna or Pfizer. You don't get an a la carte like you used to, so you gotta just get what they have. But you just gotta plan ahead. Like, it's something you literally have to set aside time for, but you do need to commit to it because it's harder. I'm not gonna say on purpose because we care, like scientists and the medical community want you to get vaccinated, want your kids to get vaccinated, but I'm hearing even some people say like, I'm vaccinated, but my teenager, they didn't want it, so I didn't worry about it. Like, that's not how vaccinations work. Like, we need everybody possible to get it, especially for our immunocompromised people that can't. We need to be able to protect them because when you're in situations like we're seeing in Texas, like once you get below a certain threshold, you're out of the game. Like, we're gonna have measles raging in Texas for what they're predicting for up to a year because now certain schools are, I think, somewhere between 25% level of vaccinated against measles, which you just can't catch up to that, where you need to get to for a threshold. So now I'm rambling. But anyway, when it comes to everything, COVID, flu, all the vaccines, do your research, keep up with the seasons, and just like make it a thing. Like the same way we make football season, all this other stuff. And look, I'm not saying vaccines are like a fun thing, and I'm not saying that it's ever gonna be like a really cool campaign. It's just something you do. And I'm not gonna say just like go to the doctor. Like, some of us don't have primaries. So a note that I made whenever you were speaking was, we now have to fill in the gaps for our community, and that sounds so obvious, but we actually have to say, like, I'm gonna take a family member under my wing. So like when your grandmother or your aunt is going to the doctor's office, don't just like call them after they went and see how it went. Take them. Because now you need to have questions ready to go with them before they go. If they only get 5 or 10 minutes to speak, then you need to have an agenda. Like when my husband goes, like, I don't even give him the space to fully plan it out. I plan it out. We're asking the questions, and I try not to go back and forth with physicians, but sometimes I'm like, I know diabetes better than you, but that's fine. Anyway, so you just want to have an agenda for all of it, because now with healthcare literally being under attack, our lives really don't matter to this federal government. They really don't matter to this governor. So you do have to slow it down. Our lives are so busy, our calendars are so full, clean them off. The priority is our health. We've got to be the village at this point, and so fill in those gaps for each other, and vaccines are part of that now. It's a chore at this point. So that's my response.
Dr. Bright, just a little bit more.
Yeah.
I recently had an experience in my family with my daughter, and as it relates to vaccines, my question is, how important, for the adult population, those who are here, to know how up to date you are, and to make sure people know that information. So, my daughter experienced an acute asthma attack, but she also had the swine flu, H1N1. And I've been asked since that incident by probably no less than 10 people, and I said, I don't even know if there was a vaccination for swine flu, and if so, I say, when my daughter was under my control, we were all, we call them shots. Our shots was always up to date. But I don't know what has been going on since she's left my control. How important is it to be up to date, know your status, and to make sure that the people who care for you know your status?
Well, that's a good point. So, and I know that's a chore too, because even when I'm trying to catch up on like where my vaccines are. So I'll use my husband as an example because what was it? It was measles, I think. So MMR, I think it was. And the cutoff, I think, was like 1980s or something. It was like if you had MMR, that vaccine, prior to a certain year, you might want to check with your primary provider. Like that's a lot to ask of people to say like, oh, if I need to figure out if I had it in the 1960s or the 1980s, and then go to my primary provider and tell them that ask them if they think I should get a re-up, like if I should get a booster of MMR. Like that's a lot. But that's the level of like intimate understanding you have to have with vaccines. And so my best advice is to have like a printout and full understanding of where your immunizations stand at this moment. And then you'll be able to have that proper conversation with your current primary provider. And to your swine flu point, I don't believe that we've ever had like this mass vaccination of swine flu. I know that there's testing around current bird flu. And I know that the Biden administration had put a lot of money towards current bird flu vaccines, but where that stands now that the CDC and NIH is under attack, I have zero idea at this point. So, unfortunately.
The H1N1 is included in the influenza vaccine.
Okay, great.
The vaccine, you get the H1N1.
Okay, great. But the current bird flu
I
is
just
not
took notes of the
included in
Peter's
the
Hand
current
Alliance.
vaccine. Yeah.
Okay, I call you the local lady, so let's bring you into the conversation. We hear about organ donation, and in our community, oftentimes it's like, I'm not doing that. What does that mean? Let's go from the basis of what organ donation looks like. We know you have to die to donate your organs, but prior to that, what do I need to know if I'm even just curious about the process, whether it be for myself or a loved one? Do I need to be well? And if I am diagnosed with some disease that I die from, does it still allow me to donate that person's organs? What is it? We know what it is, but how do I know that there's some eligibility for me or someone that I love?
And she let you push it on me. You know, all you
She's
want
been doing this longer. Not that I don't know the answer, but I'll let you answer, sure.
you know, organ donation is a topic. You go to the office of motor vehicles. You stand in line for hours, and then all of a sudden, do you want to be an organ donor?
That's a heavy question.
Do you want to be an organ donor?
I just came here to renew my life.
Yes,
Right. If you're asking me about death,
You know, we're trying to educate those at the office of motor vehicle, but that's impossible when you have that many people in and they're angry. No, we, the community educators, we must be out there to let you know what it is to become an organ, tissue, and eye donor. In the state of Louisiana, like I said before, there's close to 2,000 people waiting, 68 to 70% of people of color, African Americans, those with African American descent, Black people. When I started, there were the ages of 35 to 80. That number now, you can be 3 or 4 years old, born with it. And why? I'm so happy to have the pharmacists. I'm happy to have you out here. I want to just take you with me. Because there's no way in God's country you're going to approach African American, Black, brown people and ask them if they want to be an organ donor, not knowing the purpose of it. We're done every 2 to 3 minutes of organ failure. The pharmacist just told us we need to talk to each other. And where I come from, we didn't talk too much about the sugar. We didn't talk about sugar, which is diabetes. We didn't talk about hypertension, high blood pressure. I'm from a family of high blood pressure and diabetes. I saw it, but nobody talked about it. And this is where we need to start talking. Talk to our children. Oh God, they're getting ready to vaccine the shots. So we gotta talk to them. We gotta figure this out. We need to hook up with her. Okay? My daughter went to the doctor and they told her she was pre-diabetes. I said, girl, you got the sugar. we need Louisiana, we fry everything. We have juiced up the greens now. We got gumbo. I didn't grow up with gumbo greens, okay? But now they're putting greens in the gumbo and you're putting all the fat and all the stuff in it. You don't do that. So we need to teach each other how to take care of our bodies. Go.
Add to what Cheryl said. So a lot of times when we're having a conversation, we skip prevention, and so that's really where the conversation lies, right? We hear organ donation, and you'll get that question when you go to the OMB, but prevention is where the conversation starts. If you don't know someone with high blood pressure or diabetes, then you're not going to talk about those diseases. You may hear somebody else's family have that conversation, but you won't have it at your dinner table, right? But if you know someone, which probably 95% of us in here know someone, or we are that person, that conversation starts at the dinner table, while you're riding in the car, the first time you get diagnosed, if you see grandma taking her medication, the conversation starts within your family, and it's, what are the effects of that? When she mentioned medication earlier, I thought about my husband. One of the complications we had was with medication and anti-rejection medicine. And when they give you a prescription, if you're not educated on it and you miss it, and then you go back to the doctor like, well, this happened and this happened and that happened, they're not going to know that you missed it if you don't give them that information. So then they'll give you something else, right? For us, it was we missed it. We weren't educated on what happens when you miss it. And so eventually he went into rejection. So being educated and having the conversations the minute you get the diagnosis or you know what's going on. High blood pressure, diabetes, the number two reasons why kidneys are failing. I don't know why we as Black people are not taking it serious. That running your family, that's not a thing. It can run past you. I have a 66-year-old auntie, oldest of 5. She's pre-diabetic on no medication, right? My mom, who's only 60, is diabetic and has high blood pressure. The difference between the two is my auntie is very active. She does not smoke and she drinks moderately. My mom, she smokes. She's sedentary. She keeps elderly and she drinks pretty often. And so their lifestyle differences is what brought it on. It's not the fact that it just runs in the family. You can avoid it. It's preventative. That's where the conversation starts. If you don't want to be on dialysis waiting on the kidney, then you probably should start changing your lifestyle. Kidneys are failing because of high blood pressure and diabetes. There's no conversation around that. That's where it starts. So if somebody actually want to be an organ donor, I mean, just think about grandma, sister, cousin, friend that's on dialysis. And just go ahead and say yeah, for the simple fact that they might need it because the numbers are growing. And it's really because we haven't decided to change what we do, how we live, or start to have the conversations. And I really believe that's where it starts at.
You want to add something?
Yes, I was thinking that. And I think we also think as Black people, oh, I just had a little sugar diabetes. Not realizing that little diabetes can lead to amputations, can lead to blindness, can lead to kidney failure, now you're on dialysis. So that little diabetes, to me, is probably one of the worst diseases in our community because it leads to so many other complications that are life-altering, ultimately leading to death. So, like you said, we have to start having these conversations for prevention because if we don't work on prevention early and educate ourselves on what complications these things can lead to, then obviously, like we're saying, we're heading down a road pretty much to death. Unfortunately, that's the harsh way of putting it, but it's the reality of where we are.
So let's see if we could get to some solutions. Each one of you have talked about communication in your respective area. The experience that I shared with you, each one of you could have played an integral part. You know, she became acidic, she had no lung function, and she was experiencing organ shedding. Too much carbon dioxide, not enough oxygen. So organs, science, medication. But I think we've been saying for many years, Dr. Kinchin is in the audience, that we need to talk about these things and we still not talking. How do we get people to talk?
Well, I think, and I also want you to touch on this too. We say to talk about it, but if we're not educated to know what we need to talk about, because everybody in my family has had diabetes, so it's just what we do. We've always eaten this way forever. This is just what we eat. How do I know the alternative from eating this versus that? And we're probably not gonna like it. So in steps and stages, I think before we can communicate, do we not have to figure out what it is collectively, the small changes that we can make that are going to make greater impact?
I'll answer that as a kidney health coach, not as a community educator. When it comes to just specifically kidney health, right? We know that great grandmother had a recipe, and that's how she cooked it. And she was fine. Maybe till like 70 or 80, she found out, maybe she had diabetes or something. She was much older, right? We passed that down to, let's just say, my mom, and my mom's 60. And she's cooking the same food, using the same recipe. This is how my mama did it. And she cooks it. And she's thinking it's fine, because her mom was older when she got sick. And then she gives it to me. And it's like, oh, that's how my mama cooked it, and my grandma cooked it, so I'm going to cook it like that too. What we fail to realize is the meat is not the same meat. Okay, the seasonings are not the same seasonings, even down to salt. The salt is not the same. The milk is not the same. So if you were adding 2 cups of milk to the cake recipe, it's not the same milk. Okay, and it's not the same sugar. And so that's when I need to modify what I'm using for that recipe. Not that I may need to disregard, like take something out completely, but I may need to find it in the highest quality possible. Because sometimes it's just the poor quality of an ingredient that can then put you in that situation at a faster pace.
And you also mentioned that your mother lives a more sedentary lifestyle versus your grandmother, who probably never sat down until she went to sleep. So then there's the role of being active as well.
And outside. It's going outside, it's getting the sunlight, it's being even in environments that are non-toxic. One of the things too is riding around in your car. We literally go from being at work all day, we're in the AC, we enjoy that air. We get in our car and we ride with the windows up, with the AC on, didn't change the air filter, we don't even know what's coming through that thing. And we have really bad allergies, so we're like popping Zyrtec and taking Benadryl. Then we get home and we're in the AC with the doors closed and the windows closed. And that medicine we took earlier, we now have to add something else to that. And we have the fans going that we haven't dusted. And then we cook something that we probably shouldn't eat. And we've had dairy, and that got our stomach a little upset. So we took some Pepto, or we've added on to it, right? We just keep combining, just top it off, top it off, top it off. And then nighttime comes and it's like, I can't go to sleep because I've now consumed too much television, had this AC on. We are toxic when we close our eyes. We wake up the next morning and do the same thing again, not realizing that your organs are getting sick over time. They are created to filter your body, to help you to relieve all these toxins, but we will day in and day out just take it in, and top it off, and not give our organs time to do their job, so then they get sicker quicker and they fail faster. Because we don't do the things that they used to do, like go outside and things like that.
It's funny you say that, people criticize pork and say it's not the same pork. It's not just that corn-fed hog and that good slop. It's the injection and the steroid, because we need that pig to be 100 pounds in 30 days. Yeah. We're going to open up, and I know, Doc, we're going to let Doc respond to that same thing, and then we're going to get some audience participants, because there were some individuals in the audience wanting to ask some questions. So go ahead and respond, and Marcel do what she do all the time, because she's ready to do a community interview. But Doc, please.
I can be really fast too. I just wanted to say something because I used to always run against this, like in school and work and stuff. And, I also think it's very important, especially in the Black community. And I used to laugh about this a lot with a Black cardiologist at Tulane. He's wonderful too. And it's very important, I think, to destigmatize the way that we talk about our communities, though, because there's not a lot of daylight between how we eat, especially in South Louisiana, and how white folks eat in South Louisiana and live. And so I think it's very important to emphasize how much in the medical and science community we are still figuring out the why it's like behind diabetes and cardiovascular disease. It is a mix between environment and genetics and diet and the food systems and plastics even. Like there are so many drivers for type 2 diabetes in particular. I'm not talking about type 1, which is a whole other conversation, and type 3 is a thing, and it's a thing. But diabetes is itself the presentation of excessive glucose and insulin in your system, but it is not because you eat too much sugar. So like I want to be very clear about that, and just that like we're not this unique species of horrible eaters, you know, like, because I just every time we go somewhere,
I so appreciate
I just want to say that because
Yeah.
especially when I went, you know.
We need that. We
Yeah.
need to hear that real stuff. Yeah.
Yeah, and then the other thing for vaccines, I think it's just, even though it's a really crunchy and difficult time, I think the most important thing we can do is just democratize knowledge. I know there's a lot, it's frustrating even for me that like there's a lot of conspiracy theories around and misinformation even around the Tuskegee Project. People say that wrong too, but we just have to keep getting knowledge out there, whether it's through published, medicine and scientific articles or through conversations, like just keep talking about it.
Doc, thank you. Y'all give her a hand, y'all. I tell you, it's like when you hear people say, well, although we don't have to accept it and like it, black people kill black people, yeah, white people kill white people. People typically kill people they're around. So I like the way you clarify that and just not, like you say, demoralize the fact that we eat barbecue and fried chicken and pork chop and all that other stuff. Marcel, yeah.
You're gonna let us know when you like that cake. Okay. Coach Handy has a comment.
I got you.
My name is Louis Handy. I'm forbidden in education. I was a retired coach, teacher for 45 years. 1978, I gave my mom a kidney. 1978. She lived with me for 5 years. I was the second donor. I was an identical match to her. I have a fear when they said that they were going to operate, and once they operated, the doctor who operated mentioned to me that there was going to be a small incision. And when I woke up, from my navel region all the way to the middle of my back, I had a cut. And he said you had to take some floating ribs out to get to the kidney. I said, you didn't tell me that. Okay, I'm sore like an old man, and I go to the room. They didn't want me to leave the bed. I wanted to go see my mom. My mom was the most dearest thing to me. I didn't care if she needed my heart, I was going to get into it too. But I went to the room and she was combing her hair. I said, did you have an operation? And I'm bent over like an old man. And she's in the bed combing her hair. So of course this is her second go around. But my thing here is that the fear of having been donated goes only so far. But it's the cause behind it that matters. And my mom mattered to me. So she lived. I had some incidents. I'm speaking basically to the pharmacist. I had an incident. I had a 4D replacement on my right knee, and my orthopedic surgeon gave me a prescription for gabapentin. And I took one. I said, don't be stupid. Go to Google. And I went to Google and I started researching gabapentin and how it had an effect on your body. Then I go to my physician and he gives me meloxicam. So I read up on it. It has all kinds of effect on my kid. I don't have big wound. I don't need to lose this. I don't have I'm gonna have to go bed, ball, or steal. So my point of emphasis is don't be afraid, and also Google it. It's there.
Any comments on the panel?
I wanted to speak to the medication and the kidney, right? When you are, and the pharmacist said it so well earlier, when you are given a medication, you need to go to Google. You can use ChatGPT, or you can just go back to your physician and be like, look, I need more information. Now, they print it out for you. The pharmacist does their job. Read it. But then, two, take that information, go to see what the side effects are, and if you're already on the medication, seeing if it goes for something else. Because a lot of times the doctors are just so busy sometimes. I'm not going to say that it's intentional overlook, but sometimes they're not thinking about you're already on something, right? When it comes to your kidney health, if you don't know what your function is right now, let's just say your function is 60, and then you get on a medication and you're taking it for a year and your function's at 50. And you take it another year and your function's at 35. We're about to have a conversation about kidney disease and dialysis is coming real quick. Only because you didn't know what your function was and you thought your doctor was going to pay attention to it. But when they look at your charts, they're seeing what's abnormal and they'll address it. If it hadn't gotten into the abnormal range yet, they may not feel like the conversation is necessary. But if you're your own advocate, you can say, is this medication causing some damage to my kidneys? Can we look at something else? It's a conversation you have to have. And if you got one like me, that we gonna have it. I'm gonna be on Google and ChatGPT, and I'm trying. Look, we gonna still kill what we need to do to make sure that that kidney is well. So yeah, it's definitely different.
And not to make anyone afraid, because medications are important and they're needed. But they have to filter out of your system somehow, somewhere, some way. And there's primarily two ways that medications are filtered out of your system: kidney and your liver. So if you are a person that you know, I just have one liver left and this liver gotta last me a long time, then that would be important for you to know and to educate yourself on all medications that you're taking. How is it being filtered out of my system? Is this a medication that will affect my kidneys? So that's why I say it's so important for us to advocate for ourselves, especially when you know there's something in particular that you deal with personally, like saying having one kidney. Then those are the types of questions that you want to initiate conversation with your physicians about.
I'm going to add this as a patient rather than a healthcare professional like the 40s of experts here. Do not marginalize the importance of having a relationship with your provider. Ms. Green is Dr. Green is my pharmacist, and I know her like she knows me. And I could talk to her about anything, and she tells me everything I need to know. My primary care is a friend. So I'm not saying you have to make one of your friends go to medical school. What I'm saying is, once you make a choice, establish a relationship beyond just the visit itself. Let them know you and you know them, so you could get that level of care that you're getting here.
Another question.
Hi, my name is Sharon Woods. I really appreciate, especially the conversation about, I'm sorry, your name, PhD Dr. Radford, especially the conversation about like what does like pre-diabetic mean and things like that. It's really important to know these things. I was diagnosed as pre-diabetic when I was actually insulin resistance, which affected fertility, and was convinced like I would have gestational diabetes. I had none of that because I'm not diabetic, but understanding the different ways we get to these diagnoses is important, right? I'm an information professional, so I understand extensively how difficult it is finding information online. And you all talk a lot about doing your own research. I'm asking, how can you help people assess if something is actually correctly vetted versus just Googling it? Just Googling is also quite dangerous. Most people do not have information literacy skills to be able to assess if the person saying that is an actual professional or an influencer. And the way Google is now formatted, most of the things that hit your first page are from influencers or they are ads. So what are some websites you would suggest people know and be familiar with So they do Google the medications, and they do Google the symptoms, things of that nature, even holistic treatments. I was put on metformin, and I only had a third of my largest time tested. I would have had to go on disability if I kept taking that medication. And I found a white paper, an NIH paper, about berberine and prediabetes. And I was able to change it myself, and it worked. Working with my doctor, of course. But what are some ways to help people understand the information they're seeing, and not just, you cannot, I'm sorry, I hate to say this, you cannot trust that first page result on Google anymore. Please don't do that for any reason. Don't trust that first page. But how do people find it?
I actually don't encourage my patients to go to Google. Because of exactly what you're saying, one, and two, sometimes they get too much confusing information. So I encourage that you do develop a relationship with your clinicians, with your physicians, with your pharmacists, because these should be your first line of communication when you have questions about your health care. Now, I'm not saying never go out and do other research just to kind of maybe back up what they're saying, but that relationship that you would have one-on-one with your clinicians is more of a credible source, because they should. I try to know all of my patients by name. Matter of fact, we pretty much know them by car. They pull in and we know, oh, look, kid, keep them talking. So, that's the idea where I hope and wish that healthcare would be, unfortunately, because now the world is so driven with moving so fast, and everybody's so busy, and everybody's moving and shaking. It's not the same concept. Dr. Kinchin probably can, back, years ago, it was more of that concept where everything was more personable. But push that personal relationship. Push talking to your clinicians. Because like I said earlier, if we don't advocate for ourselves, then who really is there to advocate? So I would say, don't go to Google first, go to your clinicians.
And I would say, don't go to Google first, but in the age of information, find the information if you need to use the Google, and then go to an expert, right? So you may not have the time right then to have the conversation with them. You can still go Google your medication. I'm not saying use it as your MD, but you can Google the medication and the side effects and what coincides with it and things like that. But then you can take it back to the expert. Look, this is what I found. Is it true? And then with my chart these days, you can message them. You can say, this is what I found. You can screenshot and send them a picture. This is what I found. I just want to know if this is right. Can you give me more information? So, and I do agree with the lady, Ms. Woods in the audience, that first page is just all fluff and stuff. But definitely looking for like .gov, .org, going to research papers and things like that. But yeah, I agree. Just take that information and go to an expert.
Marcel, we may have time for one or two more.
We have two.
Okay.
We've identified two, so we'll get those in.
Yes.
I will, real fast, if I can. Yeah. I'm gonna try to do super, super quick. And we can talk more offline, because like pre-diabetes, like I think different people, especially like the state of Louisiana's definition, different clinicians have different definitions, but they're like before your A1C gets to the diabetic range is what they are saying. For pre-diabetes, we can talk more about that. But it's so hard though, because my world is obviously a bubble of scientists and physicians and providers and midwives and and all the things, and so it's hard for me to say don't Google, because like if I didn't have that, then what would I do? And so like you gotta Google. And so Louisiana Families for Vaccines is connected to a larger network. Those like nonprofit groups do get backed up with like .gov websites, NIH, CDC. That gets into the weeds, but they do connect to reputable influencers. And a lot of the reputable influencers are themselves scientists and physicians, many who used to work for the federal government, but who lost their jobs with the recent purge. So like there is a reasonable set of influencers to rely on, and like let's just email me and we can talk about like how to look for like reliable people. But like I do think it is important to be able to figure out who is real on social media, because it's not going away. I do, like WebMD is a good at least starting point to have a conversation with physician and with larger medical science community folks. And I like psychology today is good for combos too. And some of the main ones that might show up even on that first page are at least a good conversation starting point. If it's on some random dark web blog, you should be able to.
And what we'll do, we'll obtain a list of credible sites and through Louisiana, we'll get some posting and some information out there. Marcel?
So my question is, I'm going to shift the conversation a little bit. It's more directed for Dr. Green. I start off, I'll premise by saying I'm a person in recovery, about 6 years sober, and I went to rehabs, I went to behavioral health units, and while in those facilities, your provider is a facility, and so then you're prescribed a medication, maybe a narcotic or maybe a mood stabilizer, or something that's not explained to the patient, to the individual. With black and brown people being disproportionately affected by depression, anxiety, substance use, we find a large percentage of the people in these facilities, such as behavioral health units, treatment centers, drug court, begin to see mandated to these medications and are directed to these medications, but they don't have a relationship with the black or brown provider, and so their needs aren't met. And my question would be, how do you see that as a barrier in our black community, that they're either being overly medicated, unnecessarily medicated, and not treated holistically?
Before you answer, congratulations on your 6 years, Heather.
Definitely, huge barrier. When you're in a facility, like you're saying, you're kind of confined to those clinicians, and you don't have the ability per se to get an outside source. And then by the time you leave the facility, you've probably been on those medications for a bit of time, and now it's almost a battle of changing them with someone else, because now you're pretty much needing those meds to survive, to exist, to do your everyday life. So that definitely is a barrier. Now, how we combat that would be a whole another set of questions and things that would need to be done, because that definitely is a barrier. How we fix that.
And I would add, in just for time purposes, and I appreciate Dr. Green's response, but to Dr. Williams' credit, one of the things that we got to look at is the policy piece. And that's why I direct you to Congressman Fields' town hall Monday in engaging the policy piece. As you can see, we got amazing providers and we got huge resources, but I think what Dr. Green is leading to combat that, we're going to need some policy in place that gives these providers, families, recipients, caregivers the ability to challenge those decisions. So thank you for that. Yes, Marcel?
All right, last question.
I'm on Coleman, and I'm getting ready on the 21st to get my teeth deep cleaned, and they're taking me off for 7 days. Don't you think that's too long?
That's kind of that's a hard one, because as we know with Coumadin, that's a blood thinner for all of us other people. So if you're thinning your blood and then someone goes in and cuts you, you could bleed out. So there are definitely rational reasons why they're saying you have to do it for so long. It's kind of like a half a dozen in one hand, half a dozen in the other. We want to fix the teeth, but you still need to have your blood thin, but we have to get it out of your system in order to have a surgery to cut you, to ensure that you don't bleed out. So while yes, that is a valid concern, oh no, I'm happy to not take my Coumadin for a whole week, but the alternative is there's a possibility that once they perform surgery for my teeth, now my blood is too thin, it won't clot, and I could bleed out. So it's a hard That is a hard one.
My husband, they rescheduled his deep cleaning because, like, for a very similar reason, they're like, oh, you're on chemo, we will not see you for a month and a half. So, like, it's just a thing. Very, very cautious about.
And when I was in treatment, I couldn't even go to the dentist. I was still trying to understand that, but I was actually doing my time of chemotherapy and radiation. It was recommended that I don't go to the dentist at all. So I discontinued dental care during my entire treatment process. And upon returning to the dentist, there was a lot of questions related to my treatment capacity and status at the time before they moved forward. So the beauty of, I think, what just happened was we know that the precautionary measures are being taken, and I think that is a good sign. Ladies and gentlemen, as you could see, healthcare needs and deserves so much time, but our time is limited, but each one of our panelists said we have to communicate more, we need to be talking more. With that said, I would like you to help me celebrate some people. We're going to just end this on such a high note as Marcel comes back to the front. But the first group of people, we've been talking about a lot of things. If you are a survivor, you are a cancer survivor, let's celebrate you right now. Why don't you just wave your hand or stand up where you are and let people know that you did this. You did it, all right? Yes, thank you. That's a loyalty and fraternity of men and women. Thank you. If you are we talked a lot about that sugar. If you are a survivor of diabetes, we want to celebrate you. Wave your hand if you have beat that battle. Yes. Thank you so much. Yes. And if you have lived with hypertension and you just keep it in that battle and you fight, wave your hand and say, he ain't gonna get me. All right. Excellent. And I think it's also appropriate if you are a healthcare provider in any field, and I see a few of my social workers and mental health people here as well, so y'all know we've been bringing that along, but we're not quite there yet. But if you're a pharmacist, if you're a doctor, a nurse, look, if you're in the hospital, some of the most important people is the people changing the beds. If you are a healthcare provider, would you please stand so we can thank you for your service? Thank you. Yes, look at this. Thank you. Thank you so much. Yes. Last but not least, we just would like to acknowledge the sponsors who make these events free. Did y'all enjoy the food? Was that salmon good? For the Catholic people, was the salmon good? Yes. And for the non-Catholic, was that chicken good? Sun Community Housing Development Organization, thank you so much. The entire Sun Companies, thank you so much. Black Voters Matter, yes, thank you so much. Senator Gerald Boudreaux, thank you so much. Representative Marcus Bryant, thank you so much. And Louisiana Consultant, thank you so much. And of course, People Talking Media Group, thank you so much for all of the sponsorships. And People Talking, y'all heard Ms. Green say, when I put up, she said, there's People Talking coming, y'all. And I be saying, let's Dr. Green, y'all. But I'm going to end with this. Relationships matter. And of course, up the panel, now I got 3 new friends, but Dr. Green been my friend. It is those type of relationships that get providers to come out and participate in community events like this and give back just a little of what God has blessed them with and has given to them. So we thank Him for that. Now the last thing I'm going to ask y'all to do, if y'all would, my co-host. I mean, y'all just don't know, like I'm in heaven right now. I thought about trying to do TV and I said, well, if I could ever just sit next to Marcel and do the news. This is the closest I got. Get a picture of this, please. Make sure you got me and Marcel with mics and all that. But y'all give it up for Marcel. Fuck you.
Thank you very much. I told you to do a time or two. As we talked about this media thing, I'm like, look, you give your opinion way too much, sir. I don't know if that's going to work out in your favor. In closing, if you heard something today that you're going to hold on to, we talked about communication. Tell somebody. Share it with someone you know. I think our panel will be around for a little while. If you want to talk to them about something that's personal to you that you did not want to ask any open questions on the floor. And also just get their information. I'm sure they have an email address or some kind of way that you can get in touch with them. But again, if you heard something that you want to hold on to, share it with a friend. It's those little things that make big changes in our community. Thank you all for having me here with you today.
But you gotta say the last word, but I gotta add something so you don't have to talk one more time. I almost forgot. Want to do a big thank you to the DCC, the Downtown Convention Center, for making this space available for us to have these type of events. But last but not least, we're talking about communication. A big hand for the Acadiana Open Channel, y'all. This is being broadcast and covered. Acadiana Open Channel, it will be played back. And again, another means of communicating and awareness and making people know a little bit more than they knew before. So again, thank you for that. Now, Marcel, please close us out.
Okay, 13 minutes over. That's not too bad, though. Okay. Job well done. Thanks, y'all. Again, if there's something you need to know, they'll be here for a little while to answer your questions. Have a beautiful day. Let's do what we do as a community and take care of one another.
God bless.